आप लाइव हैं?
आई थिंक सुनीत जी आप स्टार्ट कर सकते हैं।
हाँ जी। Can you spotlight me? Yeah. Good evening, namaskar, and pranam to everyone. I welcome you all to Yoga Research Study Circle under the umbrella of WHRF, Women's Health Research Foundation. Yoga Research Study Circle is formed to encourage and empower women in research work in the field of yoga and health. All are welcome to enroll for research work and avail the opportunity to get their work published and recognized. WHRF also conducts training courses and workshops at our yoga studio in Sector 52 Noida and various other centers in NCR region. Details of the same are available at WHRF Facebook page and WHRF site. On every Sunday, we call upon experts from different fields to give presentations related to health and wellness. Our today's guest is Dr. Amrita Chaturvedi. She has done her MD Ophthalmology from All India Institute of Medical Sciences, Delhi, and FRCS from Royal College of Surgeons, Edinburgh. She has 20 years of experience in ophthalmology at Vedic Eye Center situated in South Delhi. She has recently joined as senior consultant and assistant professor of ophthalmology at Amrita Hospitals, Faridabad, run by Ma Amrita Anandmay Foundation. Let me welcome Dr. Amrita and call upon her to enlighten us on some important tips for maintaining good eyesight. Thank you, Doctor, and welcome again.
Thank you, Sunit
to the show.
It's an honor and privilege to be here and sharing some important and basic tips about how to take good care of the eyes. I think without further ado, I'll just start my brief presentation. So I would like to divide my presentation into 4 parts, starting with the eye care in children. As we must have noticed that more and more children we see around wearing glasses. Can you all hear me?
Yes, yes.
Can you hear me?
Yes, ma'am.
Sunit ji, can you hear me clearly?
Yes, we can. Yes, we can. Yeah.
So, you know, every day parents come with young children, and when we examine them, we realize that they need glasses. And it's quite, sometimes it's like a tragedy unfolding because the parents get so upset कि हमारे बच्चों को चश्मा लग गया, अभी बहुत छोटे हैं. So the first thing I want to say is that glasses, a child needing glasses is not a disease of the eye. It's just that the child needs a little support to be able to see clearly. And it is very important to give them glasses at the right time to prevent them from developing other problems like eye strain, like lazy eye and squint. So take the child, if any time you feel that the child is not seeing very clearly, he should be taken to an eye specialist for a proper examination. Having said that, myopia or poor eyesight, inability to see clearly at a distance is becoming more and more prevalent, especially because of this COVID situation where children have to study online for the past 2 years. Many children with very young age also have started needing glasses. So how to prevent that? See, we can't prevent it, but we can take certain precautions that it doesn't become out of hand. So number 1 is decrease the screen time. You know, when a child looks at a close distance on small objects for a long time, it stimulates the growth of the eyeball. The eyeballs start becoming longer. So the light that falls onto the cornea does not get focused onto the retina और आंख का जो पर्दा होता है, वहां तक लाइट जा नहीं पाती. बिकॉज आई बॉल का साइज बड़ा होने लगता है, इसलिए जरूरत पड़ जाती है इतना ज्यादा. द मोर दे स्पेंड टाइम ऑन स्पेशली मोबाइल फोन्स बट ऑल्सो iPad, the higher is the rate of progression of myopia. तो ये दिस इज वेरी वेरी इंपॉर्टेंट कि बच्चों को स्क्रीन देना बंद कर सकें तो जरूर कर दें. दूसरा है, let them go outside and play outdoors because natural light is good, artificial light is not good for the eyes. So all the time children studying indoors, playing video games, it wreaks havoc on the eyes. So every day the child has to go out. अगर घर में भी if the child is studying, तो कोशिश करें कि it should be near a window whose curtains are open so that जितनी natural light उसको मिल सके उतना अच्छा है. So these are the basic, very, very common tips that I want to give for younger children because it is becoming an epidemic. The need of glasses for young children is becoming the next epidemic health problem that we are facing now, And पहले ये होता था कि we used to tell the parents कि when the child is 16, 17, तो नंबर बढ़ना बंद हो जाएगा, पर ऐसा नहीं होता अब till the age of 21, 22 चश्मे का नंबर और बढ़ता जाता है, वो भी स्क्रीन टाइम की वजह से है. So somehow if we can educate the people, it's very convenient कि घरों में if the mother is busy or you want the child to be quiet and let the others do their work, उनको मोबाइल पकड़ा दिया जाता है. So that is very, very harmful for the eye. So that is one thing about the children. There are many other problems that happen in young children, but then it's beyond the scope of discussion. It's going to take it's a big topic, but this was the main thing I wanted to talk about amongst the eye problems in children. Now, the second part is about young adults. A lot of our listeners are young adults in this group, so I want to address this to them. Again, the problem is the screen. Screen has become a source of livelihood for most of us now. All the office goers spend at least 8 to 9 hours on screen every day. इससे दो प्रॉब्लम्स बहुत देखी जा रही हैं. एक तो आई स्ट्रेन, हेडेक, और दूसरा आंखों में भारीपन रहना, दर्द होना, वाटरिंग ऑफ द आईज. दिस इज बिकॉज ऐसा नहीं है कि स्क्रीन में से कुछ ऐसी रेज आ रही हैं जो कि हमारी आंखों को डैमेज कर रही हैं. ऐसा नहीं होता. बिकॉज लॉट ऑफ पीपल से कि हम उसके ऊपर कुछ स्क्रीन प्रोटेक्टर लगा दें या एंटी ग्लेयर स्क्रीन लगा दें, तो इज दैट गोइंग टू हेल्प आवर आईज? नो, दैट्स नॉट गोइंग टू हेल्प द आईज. What is going to help your eyes is to take frequent breaks from the screen. So there's a general rule called 20-20-20. That means every 20 minutes, take a break of 20 seconds. Look at a distance of 20 meters. That will relax the eyes a bit. क्योंकि जब हम पास देखते हैं, स्क्रीन में देखते हैं, तो हमारी मसल्स ऑफ कन्वर्जेंस जो कि हमारी आंखों को अंदर की तरफ खींचती हैं, वो स्ट्रेन में आ जाती हैं. So if we want them to relax, look at a distance. The other thing is palming exercises. I'm sure योगा में वो जो palming exercises कराई जाती हैं कि palms को रब करके हीट करें और थोड़ी देर आईज पे प्रेस कर लें. So हर 20 या 30 मिनट के बाद that can also be done. So that is also good for relaxation of the eyes. The other thing is dryness of the eyes हो जाती है, जिसकी वजह से इरिटेशन और आंखें लाल हो जाती हैं. लोग कहते हैं कि हमारी आंखों का ये हाल होता है कि हमसे आंख खोली नहीं जाती. ये जो ड्राइनेस है, ये भी कंप्यूटर की स्क्रीन की गलती नहीं है. ये है कि जब भी हम किसी स्क्रीन की तरफ देखते हैं तो हमारा रेट ऑफ ब्लिंकिंग कम हो जाता है. इट इज अ नेचुरल प्रोसेस, वी स्टॉप ब्लिंकिंग. और दूसरा ये है कि एयर कंडीशनड एनवायरनमेंट होती है, जहाँ पे भी ऑफिस में कंप्यूटर्स हैं वहाँ एयर कंडीशनिंग है, उससे भी हवा बहुत ड्राई होती है, तो उससे ड्राइनेस और बढ़ जाती है. तो देयर आर लॉट ऑफ लुब्रिकेटिंग आई ड्रॉप्स दैट आर अवेलेबल इन द मार्केट. So we always advise to keep a vial of any lubricating eye drop near your desktop and use it at least 2 or 3 times a day. जैसे हम अपनी स्किन को मॉइस्ट करने के लिए रोज मॉइस्चराइजर लगाते हैं, उसी तरह आईज को भी मॉइस्ट रखना जरूरी है. और अगर हम रेगुलर ब्लिंकिंग करें, कॉन्शियस ब्लिंकिंग करें, याद रखें कि इफ वी ब्लिंक रेगुलरली हमें ये सिम्टम्स कम होंगे. So that is another thing to keep in mind. Suniti, is that okay, or
yeah, sure. Yeah, it's very good, doctor. Okay. Some very good tips. Yeah.
Okay. So now I'm going to go to the next stage of life, that is around 40 years of age. So around 40, another problem starts appearing. हमें reading में दिक्कत होने लगती है. We are not able to see closer objects. छोटे prints देखने में दिक्कत होती है. lot of people say कि हमें थोड़ा बुक को थोड़ा दूर करना पड़ता है तो ही क्लियर होता है. This is called presbyopia. Presbyopia is a natural process. हमारी जो इंटरनल मसल्स होती हैं, मसल्स ऑफ अकोमोडेशन, वो 40-45 के बीच में थोड़ा वीक होने लगती हैं. उसकी वजह से हमें रीडिंग के लिए ग्लासेस की जरूरत पड़ जाती है. So that most of us will go to an optical shop and get a pair of reading glasses. And then we are done. We come back home happy कि हमने चश्मा ले लिया, जब जरूरत होगी तो लगा. Now this is a dangerous practice, because at this age it is very important to go to an eye specialist and get your full eye checkup. क्योंकि ये एक एज होती है जब हमारी आईज में और प्रॉब्लम्स की शुरुआत हो रही होती है, जिनके अभी सिम्टम्स नहीं आए. और उनमें से सबसे खतरनाक है काला मोतिया, जिसे हम ग्लोकोमा कहते हैं. ग्लोकोमा जो है, इट्स कॉल्ड द साइलेंट थीफ ऑफ साइट. मतलब कि उसके कोई सिम्टम्स नहीं होते अर्ली स्टेज पे. इफ आई एम हैविंग ग्लोकोमा, आई विल नेवर गेट टू नो टिल इट्स टू लेट. It is only if I go to an eye specialist and he or she looks inside my eye, checks my eye pressure, looks at my nerves, and detects that I am starting to have glaucoma. And this starts around the age of 40. So that is why your first eyeglasses should always be prescribed in a doctor's clinic, not in an optical shop. The other thing, not only glaucoma but also many retinal diseases, जैसे अगर हमें हल्का डायबिटीज है या ब्लड प्रेशर की प्रॉब्लम है, तो भी हमारी आंख के अंदर की जो ब्लड वेसल्स हैं उनमें भी चेंजेस आने लगती हैं, which need to be looked into. And अगर some treatment is required, it should be given at the right time before we start losing eyesight out of that. So a regular eye checkup with an eye specialist at least once a year is mandatory from the age of 40 onwards. The other thing is, अगर आपको डायबिटीज या ब्लड प्रेशर की प्रॉब्लम है, तो ये आपको ये पता होना चाहिए कि इन दोनों बीमारियों से स्पेशली आंखों पे बहुत असर पड़ता है. They can cause blindness, So a good control of both these diseases by changing our lifestyle, by doing regular yoga, regular exercise, taking good care of our diet is very important. And also, whenever you go for your eye checkup, just make sure that your retina is also checked, your nerves are checked, so that any small changes that are occurring somewhere can be detected. Eyes are a very, very interesting organ, क्योंकि हमारी आंखें ही एक ऐसी चीज है जिसे हम कहते हैं ना, विंडोज टू द सोल. दे आर ऑल्सो द विंडोज टू द बॉडी, बिकॉज हमारा जो कॉर्निया है, जो आगे का हिस्सा है, ट्रांसपेरेंट. So through it we can go see inside what is happening inside the body through the eyes. क्योंकि हमारा जो पर्दा है, उस पे जो खून की नसें होती हैं, वो उसी स्थिति में होती हैं जैसे हमारे शरीर की बाकी ब्लड वेसल्स हैं. तो हम अंदर तो नहीं देख सकते कि हमारी हार्ट की ब्लड वेसल्स कैसी हैं, हमारी किडनीज की ब्लड वेसल्स कैसी हैं, बट आंख की ब्लड वेसल्स को देख के हमें थोड़ा अंदाज हो जाता है. तो बहुत सारे डिजीजेस हम एक प्रॉपर आई चेकअप से ही पिकअप कर सकते हैं. लॉट ऑफ टाइम्स वी इवन डिटेक्ट कैंसर बाय डूइंग अ प्रॉपर आई चेकअप. सो आई वुड जस्ट दैट इज माय मैसेज हियर फॉर people who are going towards middle age, that please, it is okay to get your glasses anywhere. It's fine, it's very convenient with all the lens cart and everything online. But somewhere we'll be missing out on a lot of important diseases which need to be controlled at the right time. ये सब जो है, ये केवल चश्मा बदलने से चीजें क्लियर नहीं हो पाती हैं. That is it. And the last part is for people who are slightly older, like most of us are now, moving towards the later part of our middle age. So when you're going towards 55, 60 years of age, एक common चीज मैंने बहुत देखी अपने practice में कि people come to us and they say कि हमें अब थोड़ा कम दिख रहा है, हमें सफेद मोतिया हो गया है, हमें ऑपरेशन कराना है. So people feel कि अगर हम 60 या उसके above हैं और हमारी नजर कम हो रही है, तो इसका मतलब हमें सफेद मोतिया हो गया है. It is a self-diagnosed thing. So I want to say that cataract या सफेद मोतिया is not the only problem that happens in the eyes. There are so many patients who keep on thinking that we have a cataract, and when we will get time, we will go to the doctor and get it treated. So they come to us very late, and when we examine them, we find कि उनके अंदर या तो bleeding हुई है, या long standing retina में detachment हो गया है, या end stage glaucoma है. So ऐसे cases में then we have nothing to offer. So anytime there's any eye symptom, you must go to your neighboring eye specialist as soon as possible. Please don't delay, because eyesight is very precious. One cannot take it lightly, and one should not be lazy when it comes to the eye. One should not be lazy when it comes to the health. Good health practices are very important. But my message for today's talk is, that a shift in time saves nine. So proper, timely examination and treatment is extremely important if we want to maintain good eyesight till our last days of life. Thank you.
Wonderful, Dr. Amrita. I think it was very, very interesting, though a short one. So we have two questions from the spectators. Now, the first, you have actually answered both of them, but I think let's do another round of them so that they understand it very clearly. Yeah. The growing need of spectacles among children, especially like you said during the COVID days. Yeah. So could you just explain that once again so that it becomes clearer with the viewers?
Yeah. So among children, the growing need of spectacles is being seen very, very commonly. Among us ophthalmologists, we say that COVID ke baad the next epidemic is going to be myopia. More than, it is surprising to see the number of very young children, even 3-4 years of age coming with poor eyesight. As I said, that what we need to do is decrease their screen time. Parents have to understand that those screens are, see, the child doesn't own the mobile phone. We are giving it to the child, and, children were being looked after even before mobiles were there. We all grew up without mobiles. Our parents were managed to find a way to keep us engaged, That is very important, that take them outdoors, take them cycling, let them play in the park, show them greenery. Make them sleep properly, give them good food, general commonsensical things.
Yes.
Now, there are some medicines also available. When started at the right time, the simple eye drops without many side effects, any side effects actually. If started at the right time, it prevents the progression of myopia. I mean, agar aa gaya chashma, so it can slow it down. A child starting with a 0.5 may stay at 0.5. Does not need to go on to 6 or 7. So, so luckily now we have intervention which we can help the child. But jo bhi ho, the child has to wear glasses regularly. So parents should not feel कि चश्मा लग गया है और 6 महीने बाद उतर जाएगा. वो नहीं उतरेगा. They will have to wear it. And of course, when they are older, then there are many techniques. जिस तरह हम चश्मा हटा देते हैं. There are many new techniques, but that's it. The parents have to be invested in the health of their children. There is no other way.
Yes. Yeah. That's wonderfully answered. The next question is, Doctor, common eye problems in after the age of 50 years, which people face.
Yeah. So
which are the
other thing is that, diseases of lifestyle that we see, which yoga addresses so beautifully, and it's such an important part, should be an important part of everybody's life. they are diabetes and hypertension.
Yes.
These are the two things which affect the eyes very, very badly, especially diabetes. तो डायबिटीज में क्या होता है कि शुरू में जब कई बार तो डायग्नोज टाइम पे नहीं होता, लोग रेगुलरली जब डायग्नोज हो जाता है, then there is this hesitancy of getting proper treatment. You know, people want not to take medicine. Somehow there is this aversion, which is okay. My point is कि जरूरी नहीं कि आप दवाई से ही कंट्रोल करिए, पर कंट्रोल जरूर करिए, बिकॉज शुरू में कुछ नहीं होता, बट आफ्टर 5 years 7 years जो आंख की नसें होती हैं, the blood vessels, they start becoming leaky. And they start leaking blood into the retina. जो आंख का पर्दा होता है उसमें ब्लड, उसमें कोलेस्ट्रॉल जमने लगता है, जो कि शुरुआत में पता नहीं चलता, क्योंकि ये जो डिपॉजिट्स होते हैं ये रेटिना के सेंटर में नहीं होते जहाँ पे लाइट फोकस हो रही है, इसलिए हमें पता नहीं चलता. बट वो बढ़ते बढ़ते जब रेटिना के सेंटर में आ जाते हैं, देन इट बिकम्स डिफिकल्ट. फिर ट्रीटमेंट में इट्स अ लॉन्ग ड्रॉन ट्रीटमेंट, lasers, injections in the eye, and repeated injections, which are costly. You know? So, a person who has diabetes should get their eyes checked up every 6 months, irrespective of whether they have any eye problem or not. That is number one. The second very important thing is glaucoma, जिसे हम काला मोतिया कहते हैं. अब जो काला मोतिया है, that causes an irreversible loss of vision. उसकी वजह से जो रोशनी जाती है वो लौट के नहीं आती. कैटरैक्ट सफेद मोतिया है, वो किसी भी स्टेज पे आए हम उसको ट्रीट कर सकते हैं, हम कैटरैक्ट को निकाल के लेंस इम्प्लांट कर देते हैं, पर ग्लोकोमा we can't do any such thing. So the important thing is to diagnose it very, very early, in its earliest stage, so that we can start the treatment, so that it does not progress to a later stage when eyesight is lost, you know. So काला मोतिया में क्या होता है कि आंख का प्रेशर बढ़ने लगता है, और वो फ्लूइड प्रेशर आपकी आंख की जो नर्व है, ऑप्टिक नर्व, उसको डैमेज करने लगता है धीरे धीरे. और हमें पहले सिम्टम्स तब आते हैं जब हमारी ऑप्टिक नर्व ऑलरेडी 50% डैमेज हो चुकी होती है, तब तक हमें पता ही नहीं चलता. It is really, really unfortunate to see patients who come to us with one eye totally gone, and the other eye, you know, with the 10%, 20%, and they have no idea what is happening. You know, most of them think कि मुझे cataract है और अब आप मेरी cataract surgery कर दीजिए तो मुझे दिखने लगेगा. So it is actually tragic. So all this, you know, so there are many diseases which we have to be, at least we should know, you know, that अगर हमारी आंख में कोई symptoms नहीं हो रहे, doesn't mean कि हमारी eyes बिल्कुल healthy हैं, because aging is a process which is going to affect every part of our body. So timely diagnosis and timely treatment is the key. So my message to all people, especially people who have diabetes or hypertension, या जिनकी family में glaucoma की history है या retinal disease की history है, they should be very, very careful. And they should just, you know, जैसे हम आजकल हर एक आदमी अपने blood sugars regularly test कराता है and all that. Make your eye checkup also a part of your regular, you know, to-do list, at least once a year. That is my message.
Yeah, that was actually very, very like knowledgeable session, Doctor. So I think I would sum it up by saying some important takeaways which I have understood is, one is the parents who have young children should not get very worried when the children are developing a spectacle problem. Yeah, the most important thing is that medical intervention should be timely. They should take their children to the doctor on time once the child starts complaining that usko theek se nazar nahi aa raha. At times we just tend to delay it. Like I remember with my own son, we just delayed it for some time, but then anyway, so I would say to the audience that anytime you see any sort of problems with your children, you should immediately take a medical intervention. And what you very
Yeah,
very rightly pointed out is that outdoors, आजकल बच्चे इतने computers में और screens में busy हो गए हैं और parents have also become so busy कि वो बच्चों को encourage नहीं करते for outdoor activities, which is very, very important. I think our generation, at least me, I think I want to pass this on to, because we as kids played outside and there were no screens at that time, and that's what keeps us going today. So I think that is a very important takeaway which I understood from your session.
Absolutely.
And the second one, what you talked about, the adulthood, once you start working from the age of 20, 25 to say 50, you must do these palming exercises, lubricating your eye drops, and conscious blinking, because the screen times with the present generation has again increased like multifold. And also the thing of 20, what you said is really a catch to take away, that every 20 minutes, like you must take a rest for 20 seconds. That will again help your eyes in keep going. And the last but not the least is people of our age group. So once you have any medical issues, especially diabetes or blood pressure, you must timely take the medical intervention, and also yearly checkup. What you mentioned is very important, even though at times you know it, but you just tend to delay it. Yeah. So like every year you must fix a time that you should go into a good ophthalmologist and get your eyes checked. Yeah. And also don't wear the first glasses without a proper ophthalmological checkup. Yeah. So that was a wonderful session, Doctor. It was really nice having you over the show. And thank you very much. Yeah.